Today is Monday, December 19, 2016. This is one of the 3 terrapins in an apartment. On December 6, 2016, the owner noticed the neck is so swollen. You can see the neck is puffed up, yeah. And that was 13 days ago. Then December 8, he came here for treatment. So the diagnosis was edema of the neck. As to the cause, is possibly the paint, because this terrapin is housed next to the paint. The owners are painting the house, and but there were 2 other terrapins of the same age, and they were not affected. They are still normal, and the neck was not swollen. So you can see the swelling here, and there's a bit of swelling below as well. You can see this part is puffed up, and even you look at the legs, they appear swollen too. Let's see from here. There's some edema. So owner was given anti-inflammatory and antibiotics, but the swelling still persists. And the terrapin comes back again today, come put upside down, come back today for treatment again. He's not eating. You see the below, yeah, you see the below. Now you can see the swelling here, swelling here, swelling here. This was swollen. So these are the signs of edema, and also you can see the toe is a bit swollen. So this could be allergic to the paint, but it's been quite long. And other than that, this is the male, because male normally is concave here. There's a hollow here. Okay, put it down again. Now these 3 terrapins were allowed to wander around the house, and this one particularly likes to hide in the furthest corner, and then the family members have to look for them, and especially this one. Now the other possibility is one of the 3 terrapins had escaped from the apartment and went out. So the family members do not know which one. So now we have to find what's the cause. Now most likely for edema is heart, liver, or kidney disease or disorder. So now I'm going to hospitalize it and review again. We will give feeding. We feeding by, normally what we do is we just one hand hold it, one hand hold here, one hand hold, and then one hand touch. Okay, then he open his mouth. Wait, no, normally they open the mouth. Open the mouth. So, but quickly pump a bit in. Dropper better. Do we have dropper? We will use the dropper. The dropper. So in the meantime, I'll put him there first. Come, let's see whether he can swim or not. Put it here first. There. Let's see. Let me check whether he can swim or not. That's why I was telling you the water is not enough. So it doesn't really. We need more water than that. Yeah. So we'll check again after that. So now we just assess whether the terrapin, 2-year-old male, can swim or not. Or does he swim lopsided? At home he doesn't have enough water to swim. He doesn't have any respiratory problem. He does drink a bit. You can see his swollen limbs. As well as his neck. You can see the neck is swollen. And even his legs are swollen too. I'm assessing whether this red ear slider can swim or not, or eat. There's some pellets there. It seems that it does. He had passed some motion. On the left here, these are the stools. Now, he doesn't seem to be swimming. Let me put it up here again. And he's lethargic. Now this before I give him the furosemide injection. I'm just observing him. He just came in today with the complaint of the swollen neck again since 13 days ago. Neck is really swollen, and first lethargy. He's lethargic. Although the owner says he has not eaten much, but these are the evidence that he did eat. These are the stools. The dark ones are the stools. Let's see whether he eats or not. There is a stool. These are the pellets. Let's just observe him first. Continuing the video. Now, this 2-year-old male terrapin did come up for some air, and then now he's down again. But no interest in eating. Take the black chair. No interest in eating. Black chair. Black one. Black color chair. Then let's see again. Now I will put him up again here. He slides down, but so far he's not eating anything. So we'll put him there, and then we try and feed him. Give me a chair to sit first. Wait. Give me a chair. The stool. Give me a stool. Just the red stool, the pink stool. Let's see. Okay, so we'll try and feed him. So we'll bring up. Now we try to feed him. Now what I do is I press his throat. Normally he opens his mouth. Wait. But now he doesn't open. You press his throat with your hand. Okay. To the side, yeah. You open, press some more, the throat. This is the hand feeding, yeah. Good. Prepare some more. Don't press if you're not feeding, don't press. So we try and pump some in. Okay. Press the throat a bit. Okay. He did drink a bit, yeah. Okay. We'll just put him back in the water. I will give injection soon. Wait, after I call you. Didn't have the good appetite of other terrapins. You can see the black stools, those are the black stools. The yellowish one are the pellets. And just see whether he does eat the pellets or not. But it looks like he's not really interested in eating anything. Otherwise, normally they would just lift up their head and snap at the pellets in front of them. It's coming out. It's coming out here. You have to breathe. That's all he does. He's gonna eat one? Is he gonna eat? No. Doesn't have appetite. 2 years old, 13 days ago, neck swelling, attributed to exposure to paint. The cans of paint were lying around next door to this container, which has 2 other terrapins lying around for 2 months because the owner was painting the house. But the other 2 terrapins of the same age does not suffer from this neck swelling. This is the only one suffering. If it's only the neck swelling, it'll be easy, but there's also the swelling of the legs. Other than that, the shell quality is quite good. Okay, so just to recap, the black ones are the stools from probably the last 2 days. These are the stools, and the yellow ones are the pellets. Now I'll bring him up for injection. Where's the syringe? Give me the syringe. The syringe is here, there. So you can see that after aspirating about 0.2 ml, the neck is not so swollen. Neck is not so swollen, and the red ear slider seems to be more active because it's not so constricting to him. You can see it's about 2 ml, 0.2 ml of clear fluid. I sent to the lab now, and you can see it's not so swollen now. Okay, it's sent for swimming. Today is December 20th, 2016. It's around 6 p.m. now. Now we will look at this red ear slider again. Okay, let's look at the front. More active, it seems to be more active. You can see the neck swelling. It's much reduced, but there is still a bit of swelling. You can see. But definitely is much less than this before treatment 2 days ago. It's about 80% less swollen. Just push and see, you can push in or not. Push in the swelling, the neck. No, just see. Can it go in? Can go further in? Just hold with 2 hands. One hand hold and one hand push. Can it go in the swelling? No? Can you open his mouth? Is it more swollen? Definitely it's less swollen, but it's just that we don't know whether the swelling has gone in or not. We just push it, see whether it can go in or not. Can it go further in? No. The side, the neck seems to be swollen on this side, the right side seems to be swollen there. Turn a bit towards you. No, that side. Can you open his mouth? Check whether it's open his mouth. Check whether it can. Let's open his mouth. He doesn't have difficulty in breathing. He looks okay. He looks definitely much better. Now what's this coming out? On the foot? Okay. So we put it back and then we see him tomorrow again. December 20th, 2016, 6 p.m. But at least the swelling is gone on this part. Wait, show the leg. Wait, turn first. At least the swelling is gone on this the leg. If you see the other video, this part is swollen. Wait, turn a bit. This part turn up a bit. This part was full of fluid. If you see the other video, now it's firm. Then see the other side. Same thing. Now just turn a bit. Now it's definitely not swollen. You see, it's definitely this is not normal. There, normal, not edematous. So the drug is working, and then the foot is not so swollen. Look at the front here. Only this part is swollen. This part is still swollen. This part should be in. Should be no swelling. This side. So yes, it's still swollen. Down a bit. No, down a bit. See, I can see his tongue is much better color. So we'll see tomorrow. Okay. Today is day 3 of hospitalization of this 2-year-old male red-eared slider with a swollen neck. Now the neck is much less swollen as compared to day 1 after having aspirated 0.02 ml of the transparent fluid. Now you can see that it looks more active. This neck swelling is pen. This neck swelling is here, you can see, but it's much less. If you look at the other videos, much less here. And yesterday he did eat about 30 pellets, and now he looks more active actually. Now we look at the side. You can see the swelling has reduced, and you look at here, definitely not so obvious swelling. In fact, there's none. Now, what to the cause of this swelling for the last 2 weeks? It's hard to tell, but I suspect it was kidney disease. Kidney being liver or heart being one of the causes of edema in animals or human beings. Now, definitely there is much improvement in health, and definitely it looks more active today by moving around. Now you can see there's no it didn't really reduce 100% yet. 100% the neck swelling. Okay, so we have to monitor again. We have to monitor it for another day. This swelling is much less, definitely. He can retract his head into the shell, but not really, because normally if you touch them, they can retract the head into the shell. Let's see. A bit difficult to get in. So this swelling really under the neck really stops him from going further in. So we'll wait another day, but definitely the swelling has gone down if you compare to the other videos, earlier videos. So BioVets, December 21st, day 3, male red ear slider with neck swelling for the last 2 weeks. Today is December 21st, day 3, 10 a.m. the therapy is being hospitalized for treatment. Today is day 3 of hospitalization. Let's see whether it's 10 a.m. Let's see whether he's eating or not. The way it looks more active, being given the sunlight, the 10 a.m. sunlight, and I put some pellets and dried streams. So far I don't see him eating or passing motion yet. So let's see after 1 hour. Well, now we can see there is some appetite. He ate 1 stream, and let's see whether he's going to eat more. The sunlight definitely helps in his recovery. The neck swelling is not so swollen. Now let's see whether he eats the streams. There he does eat the dried fried stream, rather than just eat pellets alone. Bit of variety. That's good. This is 10 a.m. day 3. Day 2 he was eating as well, but I gave only pellets. It's about 30 pellets, but I haven't seen any stools yet. So now let's see. Let's see he likes the pellets or not. The sunlight is not too hot. Is he looking for the streams? Or he just looks a bit interested in food. So no action now. I will just stop videoing and then continue later. Now it's day 3, December 21, 2016. This is about 4 p.m. You look at the neck swelling, seems to have swollen a bit more instead of going down. So I need to aspirate again. But the terrapin seems to be okay. Now you can see it should have gone down to 0, but it didn't. So I will do the aspiration again. December 21, day 3, 4 p.m. December 21, 2016. This is day 3 of inpatient. I have aspirate 0.02 ml again of the clear fluid, as you can see, from the swelling in the neck. And now you can see the swelling has gone down a lot. But it's a clear fluid, it's not pus, it's not blood. So this shows that this terrapin has edema. So it will either due to heart disease, liver disease, or kidney disease. So it depends how bad it is. If it's not bad, then he should recover, but it's unlikely because I noticed yesterday I drew out 0.2 ml of the fluid from under the neck skin. And today, 24 hours later, you can still see there is a 0.01 or 0.15 ml, although it's much less. And it doesn't seem to be eating much today. So we'll wait and see. Now I'm going to aspirate more. 4 p.m. December 21, 2016. Wednesday, day 3 of hospitalization. Now is December 21, 2016, about 5:30 p.m. after aspiration of the fluid from the neck. Now you can see that the swelling is not so big now after aspiration of 0.15 ml of clear fluid from the neck. And also if you see this side below here, it's not so, it's a bit swelling again, a bit of swelling. You notice it there, there's a bit of swelling here. So it's not so obvious as if you see the first video now. So we hope that he's recovering from his edema now. But if you see carefully, that the swelling is still there actually. Has recurred again. There you see, this recurred again. So I would say this red ear slider, although it's only 2 years old, is suffering from most likely kidney or liver failure or disease due to being either he went outside and got some poisoning because he did disappear outside, or he did ingest the paint. The paint, the cans of paint was located next to the aquarium, the tanks where the 3 terrapins were housed. But the other 2 terrapins have no problem. They are normal and they're eating. This one has difficulty in eating due to the neck swelling, and there is some response when you give medication to bring down the swelling and also the inflammation. But unless he can resolve his kidney or liver problems or heart problems, then it's a chronic disease, so it will be difficult for him to be normal. He needs to be on medication throughout his life, just like people with liver disease or heart disease or kidney disease. So they need medication. I can see there's a swelling here, not too much, but there's some swelling. So this is the edema, or we call it the fluid leaking out from the capillaries and the blood vessels, and that's why it go under the skin. But in this case, the neck is also affected, and there's some blockage in the blood flow around the neck area. It's quite possible blockage or injury. Now the fluid aspirator is clear, so it won't be considered abscess or hematoma where there is blood, abscess where there is yellow pus. And now it's already 5:30 p.m. We will see tomorrow. This is day 3. It looks a bit more active actually as compared to the first day when he came here. Now I'll just take a picture. Today is December 22, 2016, day 4 of hospitalization. I've just given this therapy injection on the right hind subcutaneous tissue above the thigh. Now you can see the swelling. The swelling of the neck is still there, although 0.15 ml of clear fluid was aspirated, but the swelling in front of the knee joint, the white part which you can see is not swollen anymore. It's only the neck, although it's not as swollen as when it first came. It's about I would say it's about 30% swollen. Now you can see from the front view there's a big swollen neck still around, and you look at the side, the swelling is still there. So it seems that these are fluid, because we aspirated, we know it's clear fluid. This is from inside the blood vessels. We call it the edema. Now you look at the lower part. Give me the pen. The lower part there used to be quite swollen This part is definitely much less swollen now. And other than that, you can see this part too. Yeah? Used to be puffy. This part used to be puffy with all the whole area being swollen like a balloon. But it's less puffy now. So the only thing is how to solve this problem. So we have to give furosemide oral tablets, and that is to get the fluid out through the urine. Now you see the lower part of the terrapin. Hold it now. Lower part of the terrapin is not so bad. Okay, this is a male. Now you can see he's not really active, not energetic. See the neck is really swollen. He can't get in. He can't put his own neck in. Yeah. Can't put his head in actually. Yeah. Now today his appetite is not so good. So I've given him an injection and to bring down the swelling and also the fluid. Now you can see after aspiration yesterday, there's much less fluid here. But this part is a bit puffy. The two sides are a bit puffy. Now does he open his mouth? Not so easily as last time. So we will wait and see again for tomorrow. I'll put him in the water and some sunlight. But I don't see him eating. I don't see him interested in food this morning. He has not passed any motion as well. Just 2 years old, and other than that, it looks okay. The shell is okay, good quality. There's no pyramiding, that means overfeeding, and just is lethargic as compared to day 2. This is day 4 now. They're not interested in the food. Let's see. Pellets in front of him, he's not interested. So the diagnosis is most likely a heart, liver, or kidney disease causing oedema, the fluid accumulation in the neck and actually the back side area, but the back area seems to have resolved. Lethargy, loss of appetite. Didn't pass stools today or yesterday. Papaya beds, day 4. Red ear slider with swollen neck. As to the cause is unknown, although there's a history of him escaping, or one of the 3 escaping out of the house that got lost. And he is the one who likes to hide in the deepest corner, deepest nook, and crannies in the house. Because in the house next to the paint, cans of paint, there was house renovation. So I suspect the toxicity from the paint pigments might have gone over to him. He might have ingested it and caused kidney damage. It's hard to do a blood test on a terrapin, so this is based on observation of edema. So it could be liver or kidney as well, or the heart. Day 4, Papaya Vets, December 22, 2016. Male 2-year-old, red ear slider with a swollen neck for at least 2 weeks. the swelling does go down after injection of furosemide or furosemide plus prep, but then it comes out again. Aspiration shows a clear fluid, and bacteria and laboratory examination is in progress. Today is day 4, December 22nd, 2016. I'm still observing this red ear slider, whether he's eating or not. He doesn't eat, and you can see the swelling around his neck. Even on the upper part, you can see the collar. It's as if he's strangulated by a big rounded collar of tissue swelling, neck swelling, from the upper part to the lower part, except the lowermost part where the neck is constricted by the lower shell, the plastun. About 11:15 a.m., day 4 of hospitalization. I don't see any stools being passed out, and actually now you can even see the swelling above the neck as well. So as if this 2-year-old male therapist is wearing an E-collar, Elizabeth collar, and the only thing is not swollen, I would say, is below, where you can see, below is swollen as well. So it's all around circumferential. So there's really an E-collar in a sense. Yeah. It's wearing an E-collar. So what is the cause of this swelling? Is it circulatory problem? Is it due to obstruction or growth of the lower neck? The whole neck just have a rounded cushion, as if those airline passengers, they are flying, they buy the cushion for sleeping comfortably. So you can see really this is a strange occurrence, probably quite rare in the history or in the medical history of red ear slider. The cause is unknown, although I suspect it is due to liver, heart or kidney disease, because the fluid aspirated is clear and it's being sent to the lab for analysis. 11 a.m., day 4, December 22, 2016, Singapore, Toa Payoh Vets. Today is December 23, 2016. Okay, hold him, don't let him fall down. After the injection yesterday of PrEP plus furosemide subcutaneous on the right hind leg thigh, we turn around and see that the neck swelling has gone down considerably, very small, and I don't think you can see the top also, the top part. We cannot see already. At first the top part was swollen also. Okay, see the side here, put to the side view. We can see that this part also no more swollen. You see, no more swollen. And the other side, we turn the other side. This part is no more swollen also. Now here. Wait, turn a bit so you can see. No more swollen. Muscle is quite solid. It's because he's been walking a lot. And okay, then come back to here again. Armpit also okay. Okay, put him down, and then we get ready for him to go swimming and see whether he eats or not. Now yesterday you can see the whole thing was swollen here, and it was quite a big one. But today definitely reduced by at least 70%. Now he can open his mouth. Not so bad here, because yesterday you can see the whole thing was really swollen. Okay, put down, keep first. Today is December 23rd, 2016. This is around day 4 of hospitalization. Now as you can see after the PrEP plus furosemide injection, the right ear slider swelling of the neck, especially the upper part, is much reduced. And only thing is that I don't know whether he eats or not, whether his appetite is back to normal or not. Now this is about 9 a.m. so it's still early, but at least you can see his neck swelling is practically gone. I mean, after the injection, I can't even see it here, whereas normally you can see quite a big swelling below. So I just hope he can eat. Here's his appetite. So this is still in progress treatment. Toa Payoh Vets, December 23rd, Friday. After an injection of PrEP plus furosemide yesterday, about 18 hours ago, the neck swelling has practically disappeared. But I don't see him having his appetite. Let's see. But it's still more active now. Now is another video of this right ear slider. As you can see, the neck swelling has practically gone down to almost 10% left, and that's due to the injection of PrEP plus furosemide yesterday, about 18 hours ago. Now, whether this will resolve the problem, we don't know, but at least you can see that the upper neck, the swelling has gone, the upper one, and he can put his head inwards. He can put his head much more inwards now than earlier on. You see, although not fully, because there's still some swelling here, but practically you can see almost gone, this part, and above his head. Yesterday you could see the head was swollen, that collar around his head. But definitely today is almost normal. And then if you don't know that he had this swelling of the neck, you wouldn't even notice it. Won't notice that he had a swelling at all, because he looks pretty normal unless you're observant. If you're observant, you will see, this part is swollen, then this part below, there you can see, but the top part is okay. The side is a bit swollen, and this is considerably smaller than earlier on, which I would say is 90% less swollen than the first time we saw him 13-14 days ago. And as to the cause, I would say it's probably due to either inflammation or fluid retention due to disorder of the heart, lungs, heart, liver, or kidney. Now the kidney, of course, you can be nephrotic syndrome or kidney disease. Similarly with heart and liver, it doesn't mean that it is an infection. So I hope that he can go home and spend the Christmas at home and regain his appetite. He looks definitely more lively. Now you can see to the side, the side where he used to have a swelling. early on, that there's no more bulge here. There's no more bulge here. Actually, there's no more bulge on his upper thigh. Previously, you can see it was quite swollen, puffy. The white skin there on the upper thigh. Now it's back to normal. And the only telltale sign is a bit of swelling here, there. This one should be flat here. It should be 0. It should just be a flat shirt. Or like collar like that, it should be a flat collar, but it shouldn't be a bit of swelling here as well. That's about all. Let's see whether he eats or not. December 23rd, 2016. Toa Payoh Vets. Terrapin, male, 2 years old, with neck swelling. Actually, it's not the neck itself, but the neck, what you call that, the collar. Unlike dogs, this terrapin seems to have a fold over the neck, a fold around the head actually. So when it's not swollen, you can see it is a flat fold. You can see that, but when it's swollen,